Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place, and today's video is about a pretty common question that I get asked in the practice, which is, Doc, how often do I need to come in to receive the benefits of chiropractic care? So how long do I need to come in to get better, right? That's a really common thing. It's a fair question for patients to ask, and so I'm doing this video to kind of help address that, because it really does depend on where that person is at. That's why we do a consultation and an exam in our office. It's why we take digital x-rays in our office, so that we can look at your spine to better understand what your spine needs for you to get better and to stay better. So typically in my office, when we're looking at that initial phase of care, that first phase, we're doing the exam, we've taken digital x-rays, I'm usually going to be around that mark of at least twice a week that we want to see you, because we're trying to get momentum and get your spine doing better, get it to heal quickly so that we can get you out of pain and get it functioning properly. Now, some people, that could be only a few weeks where they start feeling a lot better. They're looser, they have better range of motion, their pain levels are better, they're sleeping better. All of that stuff can happen. Some people it's a few weeks, some people it could be a couple of months. It all depends on where you're at. What kind of damage do you have in your spine? What kind of changes are you willing to make at home? Are you willing to follow and do the home recommendations? All of that plays a role into how long we are in that initial phase. If you're willing to do things like hydrate, follow a balanced diet, get the exercise, or follow home exercises we give you, do the stretches that we recommend. If you're willing to do those things, you will get better faster. That's kind of a no-brainer, right? And then we get down, after we get people stable, we get to that maintenance or wellness phase. Now that you're feeling better, now that your spine is moving properly and you are functioning like you haven't in a long time and you're feeling better, do you want to maintain that? Would you like to stay at that level of function, or do you want to just kind of ignore it until it all comes back? The vast majority of our patients say, no, doc, I am feeling awesome. My quality of life is better. Whatever it is, I can compete again in running competitions. I can pick up my grandkids and I don't have a bunch of pain. I want to keep this feeling. So then we go into that wellness or maintenance phase. That could be anywhere from once a week to once a month maintenance care, depending on the patient, depending on what their needs are, and depending what pre-existing damage they have. So this is kind of what we try to look for in a nutshell. Obviously, there are variations from patient to patient because everybody is different, but this is kind of what we look at in our office when we're doing that consultation, that exam, because we want to get our patients better and we want to keep them better. And that comes with the education of why chiropractic on a consistent basis is so important to our health and well-being. I'm Dr. Aaron Seaton with the Chiropractic Place.